don't have coronavirus
Nope.
/ COVID-19, and hopefully it'll stay that way. I actually got COVID-19. Hi everyone, I'm back. I know it's been a long time between videos, but I actually got COVID-19 in the new year, so I've been taking it pretty easy. But I thought what I would do is get Kate to ask me some questions about my COVID-19 experience. And I asked the disability community to give me some of their questions, because I know at the moment lots of people are, rightly worried about getting it and about their experiences of, trying to prepare and all of that stuff. So I thought I could answer some questions and hopefully, share some of my experience. So yeah, let's get started.
First question. Do you know how you caught COVID-19 and what were your initial symptoms?
Obviously I didn't know I had it when I caught it, but I got it at the pool because I went with two of my support workers, and one of them unfortunately was COVID positive. Obviously, they didn't know and I didn't know at the time. And then I just started really feeling like I had a sore throat over the next day or two. Had a bit of a headache, but it was pretty confusing because it was quite similar to my hay fever symptoms. And then the support worker, they tested themselves and they found out that they had it. And then that made me kind of, worry a bit more about maybe it wasn't just hay fever and therefore I should have a test.
Were you fully vaccinated? Did you have the booster shot?
Yes to both of those questions. So I had both of my my shots, earlier in 2021, and I had the booster shot about 2 or 2.5 weeks before I got COVID-19 from the pool. And it's one of those things where, because I had the booster shot, even though it didn't stop me from getting it, I'm pretty confident that it made the symptoms, and my experience a bit shorter and a bit less severe than what it otherwise could have been. Very happy I got the booster shot.
Were there any issues getting tested?
RAT tests, so the rapid antigen tests have been really hard to find for people. I was, lucky in that I hoarded quite a few of them, and I had a couple remaining to test myself, which was how I found out that I had it. But then that was at a time where the PCR testing facilities were really overrun, and they were refusing to test people if they had access to a rapid test. So I did a rapid test and I almost threw it away because the line on the test was so faint. And my partner Kirsty, she has better eyes than me, and she saw the positive line on the test, and that kind of confirmed how I was feeling. So even though the test was quite faint, it was still considered a positive. So I never had it confirmed with a PCR test, but I was exposed to it from someone else. I was pretty confident that that's where I got it from. And Kate was also at the pool as well as me at the same time. So we were messaging each other, being like, "How are you feeling? Are you feeling weird as well as me?" And then when I got my positive test, did you do one? You did one, didn't you?
Yeah.
That was negative, wasn't it?
Yeah.
Yeah, so that was negative, and I was a bit confused because you hadn't had your booster shot.
Yeah. Just the vaccine.
Yeah, just the normal, the normal 2 shots.
Yeah.
And it was kind of interesting to me because, then you didn't have enough tests because they were really hard to find. And the whole issue with the testing was something that, I think really led me to getting it because even though I was pretty organised and I had about 10 tests, I was having my support workers do a rapid test before they came into work each day. And I had only about 4 or 5 support workers planned to come in during the week. And so, rather than testing someone every shift because I didn't have enough tests, I thought I would, test somebody, every day or every second day, assuming, they weren't going out and doing much in between. So that would, reduce the risk. And because I didn't have enough tests to go around, I couldn't waste them by, getting people to do them every day. So the support worker who actually was positive on the Tuesday when we were at the pool, I got her to do a rapid test on the Monday night, and the Monday night was negative. So when she came in the morning to come with us to the pool, I was like, there's no point you doing the test again because, A, she felt fine, and B, she'd already done a rapid test the night before, and C, I didn't have enough really to be able to afford doing one every shift. So that was kind of where the whole system fell down a bit, and that's where I think support workers need access to enough rapid tests. And I know that in Australia the NDIS is now allowing people to pay for them out of their NDIS funding, and those who have concession cards can get a limited number of free tests. But early January, when we got COVID-19, it was simply impossible to have enough tests. How did you get yours? You had to steal some from your sister or something like that?
Yeah, because she works at Chemist Warehouse.
Yeah.
So she kind of had first access to them.
Yeah.
Yeah.
And there's another question, I suppose I'll jump onto it, and it was, did your disability support continue when you were COVID-19 positive? And the answer, I think, for that one is no, because I didn't want to get people sick, and my partner Kirsty, she decided that she was happy to kind of support me where possible, and help me with getting dressed and having a shower and all of that stuff. Even though she wasn't COVID positive, she'd had her booster and kind of decided that if there is such a thing as a good time to get it would have been when I also had it, because that way we could isolate together and look after each other. So I pretty much didn't have any support workers coming in while I was in the infectious period, and technically I would have been allowed to have people come in and support me, but I think rightly many of the workers they probably wouldn't have wanted to come in and put themselves at risk.
Could've.
But you could have.
I could have.
But you didn't find out that you were positive until
a week after.
Yeah.
More. Yeah.
Do you want to talk about that if you want? I know you don't have to, but it was confusing, wasn't it?
Yeah, it was, because when I had my symptoms in the first week, I did a rapid test and it came back as negative.
Yeah.
And then on the 6th day of the isolation, the rapid test came back as positive. So
yeah. So your
and I had no symptoms at the time, so it was a bit of a shock.
And your incubation period or whatever must have been like way longer than mine, even though we probably both got it from the same place because we hadn't gone out after that.
Yeah, no, I was
after that
home.
point.
Yeah.
Yeah. Yeah. It's very strange. So so individual. The people's experience is very individual.
Oh yeah.
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 Someone said, what PPE did we use, and did my support workers get any training in how to use PPE? And also, who paid for the PPE? So that's personal protective equipment. Did you get any specific training about COVID-19 PPE?
Not really, but just PPE in general. Yeah.
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 Because you've done your nursing diploma.
Yeah.
And that's, I suppose, talks about gloves and masks and all of that
Yeah,
stuff.
and when someone's infectious, wearing the gowns and how to like glove up and don gloving and
don and doff.
Yeah.
Is that right?
Yeah, donning and doffing.
Donning and doffing. Yeah. And I was relatively organised. Like I bought some N95 masks, so the better filtration ones.
Yeah.
And I had some face shields and things, so I kind of stored them in my my little safe box at the front of my house. And so that was if Kirsty did get sick and I needed to have people come in, that was kind of my plan to allow me to get support. Someone also asked, did I have a plan in place before I was COVID-19 positive? And I suppose that was my plan. Kirsty and I decided that she would support me where possible, and then from that period, I was kind of also banking on lots of my support workers testing positive. I think from the period about a week after Christmas and New Year, I think about half of my team, at least half, probably more, had COVID-19, and so some of them were fully recovered while I was still technically infectious. So if they wanted to, and if I wanted to, they could come over and support me without as much risk of getting sick. So that's what I kind of did near the end of my infectious period, where people came in and helped, even though it was still before my 7 days of isolation were technically up. Yeah. Do you have COVID-19 or do you have hay fever?
Hay fever, hold on.
You sure?
Need to sneeze.
Pause.
Okay. Did you have a meal delivery and preparation in your NDIS plan for when you were COVID-19 positive?
So with the NDIS, I self-manage my plan, so I've got a fair bit of freedom around how I use the funding, for support workers and things like that. And often I get people to cook. Sometimes I make you cook random food. Sometimes we do it together.
Yeah.
During when I was infectious with COVID, I didn't have any meal delivery or preparation specifically included in my plan, and instead I just got someone to go shopping at Coles or whatever and drop stuff off at the door and run away, using my own money. But I know that the NDIS have since responded to the need for having meal delivery and preparation in people's plans, and so at the moment until the end of February, people can use that to get the meal delivery and preparation component paid for out of their NDIS plan. But again, something that was quite late to the piece.
Yeah.
Again, there's still lots of COVID-19 in the community, but I think for most states the peak has already passed, and so sometimes these responses are a little bit slower than we perhaps would like. But I'm very fortunate, to be able to afford that type of thing myself. But for many other people, that would have been really beneficial, and unfortunately that wasn't an option until pretty recently. But I got pretty sick of microwave meals because I was stuck in bed and pretty lazy. Yeah. What's the next question?
Did Kirsty get sick as well?
So that is the tricky question. So yeah, because Kirsty was looking after me, or supporting me while I wasn't having anyone else come in and help. We were kind of expecting Kirsty to get sick. She was expecting it. She was, I suppose, as ready for it as anyone could be in terms of she had a booster when I did a couple of weeks before I was positive. And so a couple of days after I was positive, she had a rapid test because I got my hands on a couple more. That was negative. She felt fine. She was negative again when she had another test, and there was one point where she was feeling a little bit unwell, and so she went and got a PCR test.
Yeah.
The same day that you did, wasn't it?
Yeah. So she got her results back.
Yeah, so Kirsty got her results back in about 2 or 3 days, which wasn't fast but wasn't slow.
That was good. That was good.
And that was negative, so she didn't get it from me. But what happened with yours?
On a week exactly, I got a text saying that it wasn't that they couldn't. What's it called?
They couldn't process the sample.
Yeah, because they chucked out like 91,000 or something.
Yeah, so you would have had to wait for 2 hours in the car getting your test.
Yeah, it was a hot day too.
And then they couldn't process it in time, so that was a real
it was annoying
issue. They had to throw out about 20,000 or something samples.
They threw out heaps of them.
And you were one of them, and so
yeah.
So who knows if that one was positive.
Yeah.
But if that one was positive, then your isolation period would have been
much shorter. Yeah, because that was the day after I started feeling symptoms that I went to get it. So
yeah,
who knows? It's a mystery.
Yeah, it's really hard when you try and do the right thing, and then all of these other systems don't work. But yeah, Kirsty likes telling me how tough she is because she didn't get COVID-19 from me. Even though we're literally, sharing, still staying in the same bed and all that stuff. So I'm pretty impressed that she didn't get it. But I think it's because I had the booster, so I was probably shedding less virus, spreading less virus. And because she had the booster as well, she was obviously quite impervious to it as well. So
yeah. I think the vaccines definitely help a lot, to be honest.
Yeah.
Because the way people were before, like at the very start, before the vaccines, was a lot worse.
Yeah, it's definitely helped people, help decrease the likelihood of having really bad symptoms from it.
What was worse about your experience than you expected, and what was better than you expected?
What was worse? I'm trying to think. I was, in terms of better than expected, I was happy that my lungs weren't really affected, because that was the thing that I was most worried about, because my lungs are really crappy and I'm really bad at coughing, and I don't have very good lung capacity, so my main concern was getting sick and coughing, and then needing choking and all these things that that people with a bad flu or bad COVID-19 can experience. But luckily it didn't affect my lungs at all, so I barely had a cough. It was mainly sore throat, headache, tiredness like you right now.
Yeah.
And
Sore throat?
Sore throat, yeah. So stuff like that.
Headaches.
But yeah, headaches, all of that. So it wasn't fun, but for me anyway, I was really grateful that it didn't really stuff up my lungs. But what was worse than expected, I think it made me go a little bit, I had a bit of delirium or something, there were times when Kirsty was doing something and it just made me laugh kind of uncontrollably, and I don't know why. She didn't find it very funny. Maybe I was just really tired, but I think there were times where I was a little bit delirious, and I'm going to chalk that down as a COVID-19 symptom, because Kirsty's often funny, but she wasn't that funny, and she wasn't trying to be funny, but something about it was making me laugh. And yeah, that was a bit weird. So that was something I didn't really expect. But everything else was kind of as I've heard in the media. Yeah. Any other questions?
Yeah.
There's more.
Do you think you'll have long-term Do you think you'll have long-term effects from COVID?
Hopefully not, honestly. I think I'm feeling pretty much back to quote unquote normal now. It's been about 3 or 4 weeks now. Well, probably 4 weeks now at least. And I'm feeling good. So I was definitely tired for much longer than just the 7 days. So even though I might not have been infectious beyond that point, I was still not feeling 100%. Had to take some time off work and stuff like that. But I'm lucky that I'm pretty sure I'm, have avoided any long-term effects. So
I feel like you won't
that.
really know if you have long-term effects yet, because some people who had it like 2 years ago at the beginning don't even really know what the long-term effects are.
Yeah,
that was like the main kind of worry about it, though.
I think
people don't know.
Or maybe it was where people had effects that just persisted for a long time as well.
Yeah, I guess.
But again, studies have all shown that the more vaccines you have, the less likelihood of that to occur is, which is good. So I'm happy and grateful about that. Yeah. Last question, I think.
Yeah, last one. Were you satisfied with the response from your hospital/health service?
I think so. Yeah. So once I reported my positive result, I had to give some information about myself. One thing that annoyed me really was that there was no option to put down my disability. So I don't think that was properly captured in there. So I was trying to work out if I pretend to have asthma or not. Because even though I don't have asthma, my lungs are pretty bad. So I was trying to work out, because there was no option to put in my disability, I still wanted them to know that I was someone who, would have increased chances of having complications. So I think I didn't put anything down in the end and just thought that if things got bad, I would call them and give them more information. But that was a little bit disappointing that the results of the survey, they weren't able to capture that. But beyond that, it was pretty good. They sent out a survey tracking my symptoms, and I did that each day for 7 or 14 days or whatever it was. When I didn't do it on a couple of days, they called me, which was good to check that I was, okay. And once they called, being quite concerned, and they said to me, "You're feeling better today. You're not coughing up blood anymore." And I probably shouldn't have laughed, but I kind of had a bit of a chuckle, and I thought, no, that wasn't me. So I either pushed the wrong button on the survey, or they got something mixed up. But at the same time, I was glad that they called to check up on me, because if I was coughing up blood, that would definitely be a bit of a bad sign. So I think the support was pretty good. Did you have anyone?
No, I had none of that.
No? But that might have been because you...
No surveys, no one called me.
Yeah? Did you have to report anything, or you just did the normal report?
Yeah, I just reported the rapid test. And I did it a few days later, because I was waiting for the PCR to come back. And then when it didn't, I just put in the rapid.
Yeah. Well, yeah, I think, they always say that if you do have any bad symptoms, you can always call them, but at least for me, they were a bit more proactive in their outreach. But yeah, I mean, the good thing now is that I feel a lot safer going out and about, because I'm much less likely to catch it again, at least for a couple of weeks, couple of months. So ironically, I feel a bit probably safer than I have for 2 years, really. And even though it's not something I recommend getting, it wasn't a fun experience. I'm happy that I've survived it, and urge people, if they haven't already, to go get your vaccines and get your boosters, because we want this to go away as quick as possible, and we want to avoid having a wave like this again when it's winter and everyone's inside and everyone's immunity is gone. So yeah. But at the moment we'll embrace our freedom. Yeah. And that's why Kate's not wearing a mask, because because you're not going to give it to me now because we've already got it, and so you get to see people's faces.
Very low risk.
Low risk right now. So happy about that, but and I still understand that people are really anxious about it, and definitely not encouraging people to go out and get COVID-19 at a party. But at least for me, it was something that I survived, and happy to report that everything is going okay. But I'll let Kate go have a sleep. I'm obviously boring her. But if you're still watching, thanks, and I will see you in another video soon. Bye.